Yes. Well, we've made quorum for this meeting. It looks like we just have one person waiting to join from the waiting room, but we are good to get started.
Well, I guess I'll go ahead and start the meeting. Hi, everyone. I'm Carla Anderson, one of the brand new co-chairs for the task force, along with Allie Bishop and Tilda and Sally. And so thanks for having me here. And I just wanted to make sure that we welcome a new member, Michaela. And Michaela, I'll let you introduce yourself in a little bit. But welcome to the meeting. Happy that you have joined the task force. I'd like to start with the land acknowledgement. And I would like to begin by acknowledging that we are here today on the ancestral homelands of Indigenous peoples who have lived in the Salish Sea Basin and the North Cascades watershed from time immemorial. In particular, the Lochtamish people, who we recognize today to be the Lummi Nation, the Nooksack tribe, and Semiahmoo. May we be mindful of the inherent owners of this land, our children, who are our future stewards of the land and advocates for the generation to come. May that truth guide our work and efforts to improve the well-being of all families and children, native and non-native, living in this beautiful county. This land acknowledgement is not meant to be a substitute for authentic relationship building and understanding. It is meant to introduce us to one way we can show respect and honor for the sacrifices of the first people of this land. Please join me in expressing the deepest respect for our Indigenous neighbors and for gratitude for the enduring stewardship of our shared lands and waterways. And I'll read off our agreements that the task force has for these meetings, that family and self-care come first, to be kind and gentle with yourself and others, and assume that everyone is coming from a positive place. Everyone has the best intentions. Listen with an open heart and mind, and be mindful of this space. Offer your truth and insights, and listen to other truths and insights. Treat each other with honor and grace. We are all working under difficult circumstances. Embrace diversity. Remember that we all come from different backgrounds, giving us different perspectives. And only when we embrace that diversity can we develop creative solutions to address the child and family well-being needs in Whatcom County. And what is said here stays here, and have fun. I will turn this over to Sally.
Hi, everyone. Thanks, Carla. I think that we should actually change that part of what is said here stays here, in acknowledgement of the fact that the Allison and her group have actually found a way, or have put all of the recorded meetings online, and you can access them. So in some ways that's not true. It is publicly available what we are talking about here, but I also want to say that it is a great help to know that we have those available to go back to, and kudos to our folks that help the task force in that regard. So I'll move into taking a vote. We don't need a motion, but if you want to drop it in the chat whether you approve the minutes from the last meeting. That would be great. And while we're doing that, as people are putting their approval or nays, I guess, in the chat, let's do some community shout outs and talk about what might be going on in the community that we'd like to share with everybody. I don't see any raised hands. Am I missing anything with the way that
Can I share something, Sally? Is that okay?
please?
Major shout out to Allison Williams and all of the folks on the Perinatal Mental Health Task Force leadership team and planning committee. They planned and implemented an incredible training around grief and loss in the perinatal period and during pregnancy this last week. And it was incredible. I think there were about 200 folks there from Peace Health and other providers across our county, and just a remarkable job around a really, really tough subject. And anyone I spoke to said they left feeling energized and in good spirits. And so that was really, really cool to be a part of and see all that hard work around such an important thing.
Love, love, love. So good. Anybody else? Carla, is this a good time to have Michaela maybe just say hi? We don't want to put her on the spot, but we are so excited to have a new member of the task force involved. So if you don't mind introducing yourself, that'd be amazing.
Yeah, sure thing. Hi, everyone. My name's Michaela Alum. I use she, her pronouns. I'm really happy to join the task force. Carla and Tilda recruited me. I know Carla because I have a 19 months year old 19 months old son. So I bring that to this space and this good work. And then I know Tilda from working at Opportunity Council, so that kind of represents the other experience that I bring to this work. In that I have worked for a few different nonprofits, and also the State Department of Commerce around housing and homelessness and equity. So when I heard about this task force, I was really excited to be involved. So really appreciate the warm welcome. And yeah, I'm excited to dive in.
Well, we couldn't be more excited to have you. How lucky are we to have your voice? And you have a 19-month-old, so extra thanks to you. That's a busy time. My quick shout out will be just to note how much I've appreciated Dr. Dominguez is keeping up on her Facebook post with regard to what's going on with the state and the budget. It's been really helpful. It's been helpful for me as a layperson to get lots of easy talking points. So that would be my keep it up, because I would imagine you don't just have an extra hour or two of a day that you schedule to do Facebook posts. So thanks. Anything else before we move on to public comment? All right, not seeing any hands raised or anything else, I will throw it to Allie.
Okay, I think my only job is to ask if I know we have a few members of the public here. So now would be an opportunity for any public comment that people want to share, any thoughts that our public community members that are here at this meeting might want to share. You're welcome to share in the chat or unmute. Okay. I'm really good at waiting. I teach adults, so I can sit in awkward silence for up to 3 minutes. But it seems like since no one's jumping at it, then we'll kind of leave that be, and I'll pass the baton over to Sarah for our Healthy Children's Fund update.
Great. Thanks so much, Allie. Hi, folks. We didn't get a chance to meet last month, and so I'm going to go through two reports. So I'm going to do my best to bounce back and forth between the two of them, but if I forget anything, please say, hey, what about this? And then also, I know I'll share about the professional development update. I'm going to do that after I do all my reports, so don't think I've forgotten that. If you're like, hey, I know we have a lot of folks in the room who've worked really hard on that work, so I want to make sure I acknowledge that. Um, Okay, so let's see, which one's my first one? So, some notes around our subsidies. So, as you know, we put out an RFP for our big subsidy administration a while ago. All those award letters have been issued, and we awarded the contract to AidKit. We are extremely excited to be working with them. I've already had several meetings with them to start the contract and just feel really good about this choice we made and their expertise and professionalism around distributing funds in this manner. They will oversee all three components of the subsidy project, but have MOUs and small contracts with other agencies in town in order to do the work really well. Those components are really program design and administration of the dollars going to child care centers and reducing the cost of care for families, the outreach and public awareness, and also the enrollment navigation for the subsidies themselves. AidKit, if you're not familiar with them, uses a really cool comprehensive model. So it includes engineers, multilingual application support teams, project managers, partnership support coordinators, compliance administrators, and product managers dedicated to each task. And what's been really neat is all of those people have been showing up to every single one of our meetings developing the contract. So it's done in such a holistic manner where all pieces of the puzzle are kind of taking place, which makes sense for such an enormous body of work. But I've been really pleased with that because typically we might just work with one person who's a part of a project, but for a project of this size, I'm just really, really thrilled. And also, one of the things to note about them is that they actually currently power 5 of the 6 largest direct cash transfer programs in the country. So they're very well experienced and well versed in this. They've worked with organizations like the United Way, the Colorado Department of Labor and Employment, the Urban Institute, and Prescription Kids. For those of you who aren't aware, Prescription Kids is a really cool program. I check it out. It's in Michigan and it's just spreading rapidly. They also right now are administering the Wage Boost program in King County. And so we have a lot to learn from them and the information they're gleaning, and then also really great partnerships with people doing really powerful early learning and early prevention and intervention work across the country, kind of using this direct cash transfer model. So really excited to work with them. It's already been so fruitful and kind of moving fast because they have a big contract team, so they can push through large bodies of work at a quick pace. And so that's been really, really reassuring. In addition to that, our team is still working on our peer support program contract. We're hoping to see that go to council pretty soon. And then also all of our doula contracts have been renewed and finished up for another year of service, which we're super, super thrilled about. And in addition to just kind of those contracts, all of our contracts are under this renewal process. It can be really time intensive to renew contracts, reevaluate data collection, what's working, what's not working. And so our team is really heavily invested in that process right now. It takes a lot of project management, timelines, budgeting, all that sort of stuff. And then as well, many of you probably saw, but County Council approved exactly $750,000 to be used to support families who were impacted by the flood this last December in East Whatcom County, Sumas, Everson, Nooksack, parts of Linden. And so we put out an RFP really, really quickly. It was kind of like stopped a body of work to move on to push this out during the holidays. But we put out a brief RFP to do that. And we had 2 organizations that we're going to be working with in order to administer those funds and working on that contract right now with those 2 folks. It will look like kind of housing stabilization, basic needs and case management with an option for intensive case management for families who may have had some things going on in their worlds before the flood that just compounded things. So families who had CPS involvement, families who have foster care children, families with disabilities or complex medical needs or mental health needs. And so they'll get a kind of a different level of service if that's been the case for them. So looking forward to getting those contracts signed, sealed, and delivered and those resources out to the community who really, really needs them. Let's see. The other thing I want to mention kind of in general narrative, I have also, like you said, Sally, really appreciated Christy, Dr. Dominguez's following of all the things happening at a school district level, because I've been really following another bill and just haven't had the capacity to do more. But the bill that I've been following is 2689, which is regarding Working Connections childcare subsidy. That has moved through the House and the Senate, and it's right now sitting on the governor's desk for adoption. Some things I wanted to highlight for everyone is for eligibility, it's going to stay the same. So there was a hope that this would go up to 75% of the state median income. It will not, and there's no intention date set for that to happen in the future. But one of the good things is that there was a proposed cap enrollment that we were extremely nervous about, both as our state, but also as our county, because it's a part of our subsidy plan. And so luckily that cap enrollment did not go through that was originally introduced. But I'll be honest, I'm feeling a little nervous until it gets signed by the governor in its current state. That bill, the way it was presented, was actually not presented by a House or Senate member, but was presented by DCYF themselves. And so knowing that that was something that the organization wanted makes me pretty nervous until it's signed. So that's how it stands. Thank you, Christy. Yeah, I feel like, I know I chatted with a few folks from DCYF, and they were, if I'm honest, pretty cagey about it when I asked them directly what they think was going to happen. No one felt comfortable giving me any answer at all. So we'll see. And then
Sarah,
let's see.
sorry, Sally, do you mind
Okay.
unpacking that just a little bit? Because I don't think I
Sure.
understand the significance of the fact that DCYF made the presentation as
Yeah.
opposed to a
Thanks.
legislature.
Yeah, I mean, and my understanding is that, they all the departments were asked to cut their budgets significantly, and this was a way in which they thought they could do that because they would cap how many families could receive Working Connections childcare to 37,000 families a year. And there were some stipulations around timing and when those things would begin, but it was pretty alarming as well because, I talked to Heather Powell, who runs the Boys and Girls Club, and she and I were chatting about it. And she said when she asked some folks about it, the people who presented it, the budget folks for DCYF, she said, did you consider talking to other departments like the unemployment department, TANF, all those other groups who will be deeply impacted if you choose to restrict things? And they said that, they don't have cross-department conversations around budget cuts, which I know is so horrifying to me. I appreciate everyone's head shaking, but it would be, I think, a really bad move on our part. I know, Christy, you're shaking your head. Is there anything you want to add about it?
I just think in general, this legislative session, the decisions that were made at the state level, I've been unpacking it in terms of Ferndale is in one of 36 districts in formal consultation, for example, with Lummi Nation. And it's going to be those school districts that are going to take some of the heaviest hits. So it was Working Connections, LEA, which is an equalizer in funding for communities that are property poor. TK, that was another one. And that really, and the way they changed the TK rules is, sorry, I can't think of a better word, gross, because it's now competing directly with ECAP. So now we have more of the same, and they cut that by 27 million, which is above what even the governor said. And it was just the districts and the families who are furthest from educational opportunity are going to see the greatest impact. And then what I've shared is then you hear about this great millionaires tax. And if it was actually thought about, maybe so. But like when you hear about it in terms of education, the only thing they're talking about is giving free meals. Well, the property poor districts and districts like Ferndale, we already give free and we already qualify for meals for all children. So if you compare, and Nooksack is one that's going to get hit hard. If you look at Whatcom County districts and compare them to, like, let's say Bellevue. Bellevue is not seeing the reduction of impacts that Whatcom County districts, and not necessarily Bellingham will see some, but not to the level that the rest of the county will see. Bellevue is not seeing them. Plus, they're about to get free meals for all their kids. Their kids don't need free meals, and so I just think I was almost like, how do we take all the work we've done around creating equitable access and undo it? So I'm very passionate about this, and I have big feelings.
It felt like a joke. You were like, am I reading this right?
It was shocking. Shocking.
Yeah. I see Anne and Jamie, you both have your hands up. Do you want to share that? I know this is really important to you.
I think that, sorry, I'm switching my
Oh,
phone
you're on
and
both.
my,
Oh, I thought you were Anne Gramberg. Okay, just kidding. Go for
yeah,
it.
it's just me. I'm just switching my from my phone to my computer since I just got in the office. I think that it's important to know that there are things in this bill for DCYF that will affect local childcare providers. There are right now there are things in it where we can bill a child. So in a private pay family, we can bill for a full month, whether or not the child tends. And so that's really important. In DCUF, I don't know how many years ago, well before COVID, changed billing so that we could bill even if the family didn't come all the days that they were supposed to. But now, in order to save money, they have changed that. So they have this very complicated, very difficult to read chart that they just put out about how many days we can bill depending
Like
on
16. Yeah.
what the child comes and if they're absent. And a lot of families that are on working connections are kind of, not a lot, but there's a fair number that are in kind of unstable situations. So it's not uncommon for them to miss days. And so now that we won't be able to bill for those days anymore, that will affect local early learning programs as well. Just food for thought.
Right. Thanks folks for sharing all your insight about that. Okay, and so I guess we're watching it. It's on the governor's desk. We'll see what happens and where they choose to go from here with that. But certainly something we're keeping our eyeballs on, and we're not finalizing our contract with AidKit until that bill is finalized, because that will impact the approach we take with our own local subsidy. And then also how we lean into providers who are taking kids with working connections, because that's a part of that part of the subsidy plan. But it's something that our AidKit team is aware of, and they're also watching and following, which is nice. So they're keeping up with that as well. In terms of staffing updates, last month we didn't have any, but this month we do. Super cool. But Allison Williams, as you all know, has been working on this doula program for quite some time, and we've grown to the place where we needed someone part-time hourly to support this work, which is really amazing. And so we're hiring someone part-time hourly to support the referral coordination, all the coordination of the mentoring and training, and we're in the final phase of that process. But feels like a really big, exciting place for us to be, to kind of be growing in that way. And then lastly, our website should be up any single day now. I just got an email while we were sitting here to open it up. It's already on our system, but I was out last week in the great frontier in the tundra, and so they didn't want to launch it without me. Everyone got cold feet, even though I was like, go for it. Maybe they just need someone like me to pull the trigger. So anyway, really excited to get that launched, and we'll make sure that you all see that right away when we do. But those are kind of my big, let me make sure. My big hits for the contract and all that kind of world. I'll give an update on the professional development piece. Carrie Ann Carrie Ann, oh, there she is. Oh my gosh, I was like, is she in the room? Is she on the screen? She's on the screen. Carrie Ann and I have if I'm honest, many months ago, used all the information we had to propose some ideas for the professional development network, and we are waiting on the legal counsel evaluation. So until we get that legal evaluation, we don't feel comfortable moving into doing what we said we would do, which is doing outreach to providers and folks who've been working on this plan to discuss it more with them. And so our counsel, if I'm honest, after Chris Quinn left, Sally, I just don't get the information I need at the pace I want it. Tell him I miss him dearly. And so just waiting on some efforts from our attorney's office. I spoke to one of them today and hoping to bump that back up to them. But I don't have anything significant to report besides the fact that we have a lot going on here at the county, and waiting for some legal review until we can move out and to share with folks and get folks' opinions.
What is it that they have to review legally about meeting that objective?
Oh, well, we're trying to supplement and pay for we're trying to figure out a way to pay sorry, it's been such a long day. I'm feeling like I'm losing words at this point. We would like to be able to pay staff stipends for receiving their training. We know wage boosts are really difficult. That would be hard for us to do. Is there a way for us, like the Imagine Institute works with DCYF to pay in-home childcare providers a bump when they do their trainings? Is there a way for us to also do that with center-based staff? And so hoping to figure that out.
So it sounds like, Sarah, this is like a continuing, kind of a continuation of that gift of public funds piece. Like, is that related to like kind of how that's been a barrier in a few places? Is this related to that?
I mean, I think it is that is a question of if it's a gift of public fund. That's the question the attorneys, I think, are sorting through. Yeah. I will say, Karen and I are not talking about it. I mean, I hope that sometimes when you don't hear about things on our update, it probably feels like we're not discussing it, but that doesn't mean we're not thinking about it, thinking about ways to add it to other contracts, professional development opportunities. But at this point, that's kind of where we're at with the larger project. Nothing's moved. We're not talking to people about something that's moving forward without consent and community input.
Sarah, how long has it been with legal?
I'd have to look it up to be sure.
Okay. I'm just curious if you have I mean, you probably don't have any kind of ETA from them, huh?
So I'll just jump in here because this has been, we had our attorney that worked closely with us that knew this work really well from the beginning. Chris is gone. And then we were given 2 attorneys to kind of work with us that would bounce back and forth. And then now those 2 attorneys have been moved into other areas. And now we've received a new attorney who has not done this work before either. So every time we get a new attorney, there's also the learning curve of it. And this is just one of the many programs. So I know it's incredibly frustrating and I get to be the annoying manager that comes on here to say this, but Sarah keeps ringing the bell and trying, and it's just,
I'm being really annoying.
Yeah, this division has gotten really good at being really annoying to our colleagues across the county. But it's just a matter of general understaff, like countywide in all of our areas. So
I just don't know who I need to go and like throttle. I like the workforce development portion of every single early learning bill or portion, whether it be the state or the county or federal, is just like this. And as someone who works in the field, it's really difficult. And I would be happy to write letters and to talk to people. I don't know who to talk to and write letters. How can we get things moving? Because it's just been this fund has been going for so many years and we just don't have any movement on the workforce development portion. And as someone who works in workforce development for this area, it's just like almost brings me to tears that it's that frustrating.
Yeah.
I am sorry, Jamie, and I recognize it and understand the piece about the tiers. And I will say, as somebody who's been with the county for a while now, the competing demands, the housing also has workforce. I mean, everybody's got this. And so anytime we try to approach anything, we're told, well, my priority is actually really important to this community and what we do. And so this is just like where we're at. But I will say, because I think it's always, even though it bites us later, I always encourage folks to vocalize, their needs and their concerns in a public forum. If if you want to go to speak out at county council during open public comment, you can do that. Just recognize, there's just also a need for more money for us to be able to operate as a government. So those are the things that I think council needs to hear. Electeds need to hear, like, these things are priorities for our community. So what can you do to help get it going? So anyway, sorry, I'm going to stop talking now.
That's thank you, Anne and Jamie, for voicing that. I mean, I think another piece of the state budget is that 50% of the professional development budget specifically for early childhood educators has been cut. We don't know exactly what that's going to look like. And so we've been in crisis for a while. A more visible crisis is pricing for families. We definitely get that. Accessibility to childcare, cost of childcare, but quality of childcare is declining. I'll say that with seriousness, and someone who spends time in early childhood environments, because the training and professional development is not there. And that support, we have support systems in our county, in our region, that are worn pretty thin, right? So when we think about what already exists, I think one of the things that is good to recognize is that we do have community college and from like your regular STARS hours, which is what a childcare provider needs every year, all the way up through getting an associate's degree. All of that is possible in Whatcom County, which is pretty amazing. But we don't really have that cohesiveness, right? So I think one of like, how do we put all that together so that someone who works at the Y or someone who owns a family childcare center who cannot go to community college classes can say, what do I need to do in order to be the director of a school? And there's someone who can say, this is how you do that, because everyone's path is different. It's really difficult to help providers and staff navigate that journey of wanting to stay in the field. And so it's difficult for us to retain staff. And it's difficult to recruit staff because of those requirements right at the beginning that you need to have within the first few months. And I think a curiosity that I have is, and I know we're on that like stuck in legal gifted public funds piece, but I think it would be good to know if we can get more information around whether or not this is turning into an RFP that's going to go out towards systems that already exist, or if this is something that you guys have some other ideas about. Because access, I hear you talking about access, Sarah, about paying for staff training, which is super important, because that is a barrier that we see to people having those trainings. But I wonder if that's information you guys are able to provide.
I could share. Thanks, Sally. That was such a great summary.
Sorry to like be on a soapbox. This is what I do all day.
No,
so I'm gonna.
I love it. It was really nice to listen to. I would say no. Our plan is to RFP for this work. We don't see ourselves doing that or doing that internally. Certainly, right? Like working together with experts in the community to build what the RFP looks like, and using our team and Carrie Ann and stuff, but not doing that work internally. We know there are experts in the community who can do it.
Sure. Yeah. Thanks. Yeah. I mean, I think there's a lot of ways to do it. You guys get to kind of put things out there and see what comes back. And I think there's a lot of, different routes to go with the professional development piece and the training piece. So yeah, it's just good. I think that clarity is helpful for us to know, that it's going out to see who can respond to it. So yeah, thanks.
Yeah. Thanks, Allie. That's all really I have to say today. I feel like that's the most I've ever spoken to you all in a long time, but there is lots of stuff happening. And although there are lots of pressures at the state, I think we continue to be so lucky that we have the minds we do in Whatcom County, the creativity, the interest in working together. I mean, the training that Al, did last week was such an example of like people coming together around such a really specific thing, death and dying in the perinatal period and grief and loss. But people are showing up for one another here in Whatcom County. And I feel really lucky to have this fund and get to work with all of you to do this. So thanks for being here. And if you have questions or want to meet with me one-on-one, always happy to do that.
Awesome. Thank you, Sarah. Really appreciate it. Yeah, what can we say? It's tough out there. So the moment you have all been waiting for, which is when we get to talk about the report card. And this is what I have in mind with regard to the report card. I do not want to make assumptions about the time and effort that you all put into the task force, but I am going to take a note for myself and assume that you may not have had the chance to read that report card before the meeting started. And as much as you all know from me being on these before, how much I hate silence, and it's very difficult for me to sit in the silence, I would like us all to take a few minutes, if you need it, to review the draft report card so that we can talk about it. You might not need it. Great. Get on Facebook and read Dr. Dominguez's last post and, do something else instead. I'm going to turn my video off. I'm going to start it at literally 4 minutes. And so we'll be back on at 4:12-ish to just talk about the report card. And if you want to also, if you didn't have a chance to review the SEBA audit as well, let's go, and starting now.
Very long, so I did not print it, but it is in your email.
Is it? Oh,
It was in the attachments. It was, I put a lot of attachments in this,
Okay.
in this month's emails.
so we missed it. Thank you.
No worries. But yeah, that one was a 60-pager and I was like, oh, let not print that one. So it's at the top of your email. Yep, I'm gonna send it because it's named. It was labeled HCF External Eval 12/29/2025. It has kind of a weird name.
Oh.
The file. So I just popped it up to you though.
All right, thank you.
You're welcome. And apologies for not printing it. I was thinking about it. I was really thinking about it.
Yeah, yeah. And I'll look at it online. They say they're gonna change.
Um, in the report,
Yeah, this is.
yeah, that's a good question. I believe there's someone maybe here from that. You
Okay.
can ask questions too if you have a question about it. Um,
Okay, everybody, let's start getting back online and see if we can go through the report card. So I'll just kick us off by saying that this is the third report card that I've been involved in with the task force. And the best part of writing this report card was to be able to acknowledge the significant improvements in the administration and the implementation of the fund. The first report card I was involved in was it was frank, and it wasn't overly positive, but it was hopeful still. So it's great to come and say these are all the things that are being done and have been done, and the improvements. I'm going to just invite comments on it, and I'm hopeful that you all will give them. Hilda.
Hi, everybody. So, I mean, I can start us off by saying I see some pretty clear alignment in some of the issues we were just talking about with Anne and Sarah. I see them reflected in this. On page 3, we talk about bottlenecks at finance and legal, and we talk about a significant underspend in Healthy Children's Fund admin funds. And what can we do to release the pressure on that bottleneck? And then on page 4, we're talking about gift to public funds, which sounds like is a big part of that bottleneck. And a couple of these things, if we could just get them squared away once and for all, things would move so much more smoothly.
Yeah, I mean, well, I think, Anne, you're still on if you're able to, or Sarah, whomever. I personally take the position, and I think our recommendation here is succinct on it, is on the gift of public funds, which is that we're recommending that the county take a really clear position on that. And so it may be that the task force needs to make a recommendation to county council to say, we recommend that you determine that everything in the ordinance is considered to be a public policy in order to allow legal to feel more comfortable with it. That might be one thing. But I have always had this consistent curiosity, especially with what appears to be an underspend on the 9% admin budget, as to why that amount can't go to help other departments in the county that are needed to facilitate this fund, but don't have the manpower to make it so.
I am happy to speak to the 9% piece of it. So we're not going to be underspent for much longer going forward in the future. 9%, to be quite frank, at this point with the staffing. I mean, Sarah's done a great job of staffing up as much as she can. She'd actually, I think, probably like another person, but we can't actually afford to take on another staff person through the life of this fund. 9%, I mean, it's just a little bit under $1 million, and staff are expensive, especially with the county. So I will say, as a manager, we don't have any to spare at this point to share across other departments, unless we are going to look at what else we scale back. So I guess that's me being pretty frank without having gotten the okay from my boss to talk about it. But it's stuff we've started talking about. Is that the federal rate now for most of our content for everything is 15%. So, and that's not enough for our smaller nonprofits and agencies to even be able to operate. So I guess, I don't know, Sarah, if you have any other thoughts on this, but I don't see us at this point. I don't think us taking any more admin fund and paying for specific positions, I think the challenge is more just capacity across the entire system. And there is not enough money within Healthy Children's Fund to pay across the entire system. And yeah, so I don't know.
Yeah, it's tricky when you look at, I have a budget worksheet I use for the administrative budget for the whole length of the fund. And when you look at, cost of living upgrades and all those things, all of us who run budgets, it just adds up really quickly. And so sadly, that 9% is eaten up with our current staffing structure, which I don't even pay full time for all the staff who support, my work. Some of those funds come from other places. But I do think it's important to highlight that we have this fund that we're supposed to administer and don't have all the administrative support in order to do so. And, are there other creative ways besides having more staff to do that, more technology that supports efforts to move things smoother and more quickly? There are other ways to do things to be efficient. And so that's one of the things I think about and my team thinks about, to streamline systems. But yeah, that's one of the challenges we face with the 9% administrative rate is just how it compounds over time. And especially Sally, one of the things too to note, for example, Allison Williams' position was funded differently, but because of FPA's just dollars and other money leaving the state and from the federal government, we're moving in more Healthy Children's Fund dollars because we know maternal mental health is a key component of this work. We want to keep funding these positions full time. And so we've had to move in and fund positions that we weren't previously funding in order to maintain that work.
Thanks. I mean, that's a really good takeaway for me in I think highlighting a misunderstanding I had about how much of the 9% was used. Is probably an old takeaway that I have. You're clearly using the 9%. So thank you.
I mean, I think
really
at first, Sally, though, it didn't, it took a while to staff up. So I think I totally see where that was an initial concern. And I think it was a valid initial concern, right? Carrie Ann's position was vacant for a while. Allison Halverson's position was vacant for a while.
Yeah.
We needed to get those positions up and running.
We also did initially use ARPA funding for a lot of things, which helped it, but that funding is long gone. So now everyone doing this work is dependent on Healthy Children's Fund, and it adds up quickly.
So when I look at, and just as a reminder that the time we want to spend now, which we have plenty of to do, and we don't need to use it all either, is to get approval for this report card. And also, I think for most of you, it will be the first eyes that you have had on the SEVA audit that came out, and they're not the same, they're different, but we also want to respect that they have overlaps, which is kind of the tone we decided to take in this report card, is recognize that this has been a very busy forward facing year for the Healthy Children's Fund because of the implementation plan that came out, which created a lot of stakeholder activity opportunity for community health to be in front of council on that issue, as well as SEVA and being the first outside audit. So there's really kind of no point in telling council again and again stuff. So, but also really then being able to double down on those things that are already being highlighted. So with that being said, any specific, and I see the things in the chat, at least on, getting the names right, that sort of thing. Anything else that would specifically be a change that task force members would like to see in the report? I see, Marie, your comment about looking at pushing the RFP forward without the caveat of paying a stipend to get things moving.
And Sally, that's public comment.
Thank you. Sorry, I appreciate that. So any comments from task force on changes that you would like to see in the report? Tilda, you have your.
That's why I said that about, we said we'd be here at 1.
Well, I wonder if we should walk back that recommendation on page 3 about expanding capacity in the departments within the county that are required to support in administration, since it sounds like, if I'm understanding what Anne is saying, it sounds like we are not underspent in admin.
I would actually not like, or I would counter not walking that back, but maybe clarifying. I don't think that we make a recommendation in the report card that the Healthy Children's Fund monies be used for that. And so I still think it's an important recommendation that they create expanded capacity in those departments that are needed.
Yeah. Okay. Gotcha. Thank you, Sally.
Down on it.
Yeah.
And I think that there's a couple of big things that we could probably do here. And remember, we're going to be able to present this to council. And I think being able to go in at council, which by the way, at the end, if once we get this approved, we'll be asking for volunteers to come to the county council meeting where this will be presented. And we're always up for new presenters and opportunities for people to get in front of council on it. But my experience in participating the last 2 times we presented the report card is county council is very engaged and they want to hear from us. They will have read the report and we're going to be able to emphasize things verbally that we have in writing, but expand on them and create more around them. And really, I think we should take the opportunity to talk about the fact that we can't have an isolated fund that can't operate without the county, that doesn't have the systems overall to support it, which is case in point 1. And then number 2, I don't think that was the right expression of case in point. That was just point 1. And point 2, gift of public funds, still an issue. And I actually feel really good about the language in the task force of acknowledging that it appears that it continues to stymie things. And it's not that it won't eventually make it through or it won't eventually get approved. But in the meantime, people, lawyers, get wrapped up in their heads on this issue. And I do believe that there are ways that we can get past this so that it isn't such a sticking point. And I think one of those things we can do is potentially as a task force come together and ask county council to pass something, whatever it would pass, to say that childcare and all of the things in the Healthy Children's Fund is a public purpose. I think that will help loosen this issue of the gift of public funds, maybe. Councilmember Boyle, you're off mute.
Thank you, Sally. I was looking, I couldn't find my hand raised thing, but maybe it's, so thank you. I was under the impression that the executive is between 40 and 75,000 and the council 75,000 and over, but am I totally wrong on that?
No, that's right.
Okay, but is that one of on the last page, it said recommended that the threshold for the approval be raised. And we think that the recommendation has not yet been implemented.
Will you say that again? So that maybe, did we just simply get it wrong and that threshold has been moved up?
I thought so. I thought it's been raised to 75,000 and the executive's office has to approve for between 40 and 75. But Sarah, you'll know 1,000 times better than me.
No, that's correct. That's correct.
Okay.
Although
it was moved up to 75,000. It used to just be 40,000.
Exactly. Yeah. So
Allie Panucci, the former deputy exec, her recommendation, I believe, was 250,000. Just for the record, $75,000. We don't do anything over 50 grand anyway, for the most part. So it doesn't, all Healthy Children's Fund contracts still go through county council.
Gotcha. So the 40,000 threshold needed to be significantly more
yeah.
So
we do smaller contracts that are like $10,000 for little LOAs for people to help us with things and do contract work, but that's kind of a different ballgame.
Mm-hmm.
And just for reference, I believe the city of Bellingham is closer to 200,000 is their threshold before it goes to their council. So
it was an interesting council meeting if you want to listen.
So will you guys help me so the 40,000 threshold for requiring council approval, it's now a $75,000 threshold.
Correct.
But where's this executive piece of between 40 and 75? Executives still need to sign off if it's between 40 and 75, as opposed to just the county head that the department.
The executive signs off on all of our contracts because
that's why I'm confused.
Yeah, no, the executive signs off it. The 40 to 75, I don't know how much it's going through the whole process of manager, director, legal, finance, and then it does eventually wind up on the executive's desk. But regardless of the amount, it'll be at the executive's desk.
It just means it doesn't have to go through county council. So
Yeah.
under 75 doesn't go to county council. And then anything over $40,000, we have to have a formal RFP process. So there are some stipulations around that if we use something called the MRSC, or it's just for services, but no concrete goods. But that's really unlikely for us with the Healthy Children's Fund. So you could think about it as, anything over $40,000 has to go through a formal RFP process.
But so for this report, though, that second to last paragraph should be updated, because it says there's a request for raising the 40,000 threshold for contracts requiring council approval.
I agree completely. We need to change that to what I would recommend, and I'll make my notes for myself. So when somebody or whomever, maybe me, makes a motion to approve the report, what I would suggest is we change that to say raise the threshold for contracts requiring council approval, and note that in the March 2025 report card, we recommended that the threshold be raised, and that we acknowledge that it was raised from 40 to 75. And then this is where I would need to put it to the task force, is that we still believe that raising the threshold higher would help facilitate administration of the Healthy Children's Fund, if that is in fact this task force position. It was previously, I think that we took the position that it should go to, I think it was $150,000 was our prior recommendation in the prior report card.
Match with the city of Vatican. Seems reasonable.
Okay, what I'm going to do right now is I'm going to make a motion for us to approve the report, and I'll make a few caveats. And then once we take the vote, assuming it passes, then we could go into asking for volunteers about the presentation, and then a small set aside of time to just discuss the SEBA audit report in general. Okay, so here's my motion. I move that the task force approve the report card as presented in the emails that we received for the task force meeting, subject to the following two changes. One is to make sure that we have double checked all of the names. I know that we need to fix the co-chairs, and I believe we may still have Councilmember Scanlon instead of Boyle as being on the task force. The second change would be to note that we recommend raising the threshold for contracts requiring council approval, deleting the note on the 40,000, at the same time acknowledging that there was a change from 40 to 75, but that we stand behind still an even higher threshold. Do I have a second for that motion?
I second that. This is Sterling. I second that.
All right, let's drop our votes in the chat, please. Is this a fist to 5? Will someone tell me?
Yes, this is fist to 5, and I can put that agreement in the chat now so you all can be reminded what that means. And you can choose your number accordingly. 5. 5. Okay, thank you. That is approved. Thank you.
That's good. That's fast.
Well, very good. Thank you all. Excited to get this done, send out to council, and then we get the opportunity to talk to council about it. Allison, do you know what our time period will be so that people can volunteer with the knowledge that they would need to show up? Although they probably could participate remotely.
Do you want me to jump in, Allison? Yeah. So, so let's see. Today's the 23rd. We will get in the materials the next date to get in materials is April 3rd, and so the meeting will be on April 14th. Typically, we present to Public Works and Health, which tends to be around 10 or 11, but that shifts a little bit. But I would expect like April 14th before 1 p.m. and probably after like 9. What do you think, Elizabeth? Yeah. Okay, great. Are you the chair, Elizabeth? I mean, Councilmember Boyle. Sorry.
It's Elizabeth. Yes.
Okay, thanks. I also just want to say thanks for, taking the time to write this. I know that our team has worked really, really hard to make changes, and things aren't always, and they're not perfect. And we totally recognize that. And I think that actually really drives my team to do better and work harder, because we are so committed to the community. And so we really appreciate all the efforts you guys make to highlight those things and bring these things to the public eye to help us continue to raise the standard for what community programs and government work looks like.
Indeed. Okay, this is actually a fun time. I think the presenting of the report, especially when we have exciting things to things to be excited about, but also things that I think we're really excited to double down on, triple down on in front of council. So, and I know that April 14 is a ways away. We'd like about 4 people to present. I know that the co-chairs will do it if we need to, but we really encourage and we're happy to talk with you, give you easy talking points, make it simple so that any of you can be a participant in this process. Anybody interested? I guess you all. Oh, Christina Jackson.
Yes.
Love it.
Happy to help.
Awesome. Christina, I'll send you an email and we will do a little co-chair plus Christina. Oh, that was my dog. He just groaned really loud. We will get together and, over email and come up with some talking points and present and that's so great. Thank you so much. And anyone else, if you change your mind, let me know. Send me an email, send any co-chair an email. We're happy to have you there. It really is a great time to get to know council as well. All right, so 436. I thought it'd be interesting just to talk a little bit about the SEBA audit. I thought it was good. I thought it was helpful. I thought that we should all feel good in the sense that the things that they were saying, I felt like there was no new information in there. Like everything in there had either been brought up on its own by community health or the task force are brought up, or so, that was affirming in some ways, but in both ways. One, we're not missing the mark, but also like it's doubling down on that information constantly that, it really is an issue. I was super jazzed about the fact that they brought up something that I think the task force has been bringing to council for a while, which is if you improve the way that the Healthy Children's Fund is administered, specifically with regard to contracts, RFPs, you are going to improve the county overall because it's not going to be a one-off that is just helping this. It's going to help the county across the board. So that was helpful, and I was excited to see that. Comments from others, or even while we've got you here, Sarah, sorry, I know usually you can't stay this long because I'm told you have other things to do besides attend our task force. But how are you guys feeling about it? And are you planning on presenting to council in a sort of counter report or no?
No, I think what you said, Sally, like nothing was a surprise. I think I shared this with the group. I'll share again. My team actually did an internal audit of all of our work beforehand as like a opportunity, of course, to continue to build and improve. I think that's just our natural way as a group. And so everything that came up in that was in the SEBA report. And so, yeah, I think we agreed with everything. There are some things that maybe we wouldn't do it exactly the way they said, but I think everything they hit on were all areas that we could see that there's opportunity for improvement and could do things more. I think a lot of the things I read, it was like expansive, do more, do bigger, dig deeper, all the things we want to do too. And so, and I think, I always refer to the Healthy Children's Fund as the canary in the coal mine. The Healthy Children's Fund ordinance is very clear and specific about what we're supposed to do and how we're supposed to do it. And like the SEBA audit said, if we did a lot of those things differently, it would benefit more than just the Healthy Children's Fund. It would benefit all the systems at the county. And so I think that is both one of the one of the challenges of the fund, right? Is it feels very specific only to the fund, and yet it would actually be this enormous benefit for everyone.
Okay, well, we don't need to belabor the point. And before I wrap up, I'll just say that, without Colton here to remind us that there are other things that we talk about as a task force, I will do that. Not that Colton's not still in the task force, he is, he's just not at this meeting. But he's just so good at continually thinking about what's our next thing. And so, in writing the report card, I was reminded that, hopefully that job gets easier and easier. Things get streamlined and more streamlined. And we're really just like an extra set of eyes. And we're looking at the next thing that this task force is going to do. I think personally, the next thing this task force needs to be looking at is jail implementation. So just putting that out there. I am going to throw it to Tilda 5 minutes early.
Whoa. All right. So last time, no, it was a couple times ago, we were joined by the new director of the Community Services and Health Department, Champ Thomas Cuddy. And Vesla had some questions in the moment for him, but they were pretty involved. And so we didn't want to put him on the spot. So I believe Beth or Allison captured those questions, and we're going to give them to Champ to kind of, mull over and process and get us, I believe, correct me if I'm wrong, Allison, was the plan to invite him back to a meeting and then he would be able to share his thoughts on those things?
There wasn't much of a plan. Beyond just figuring out if we want to invite him back to talk more about the 3 topics that I just had dropped in the chat there. Those were the topics that were identified. And so I guess it's really up to this group to decide how they would like to hear a response. Do you want to invite him back and see what meeting he's able to join us at to talk through this with the group more? Or are there specific questions you just want to send him, and then we can get an email response and then share it out with the group? So it's really up to you how you want to receive that information, whether it's through a meeting or through written format.
And whether or not we want to add any questions?
Yeah, and exactly what information you're hoping, to get from him, if it's just those 3 topics, or if there's some extended information you would like.
Boy, I just feel like we just keep coming back to the same couple of things here.
Yeah, that stuff from Allison in the chat was deja vu all over again, right?
Yeah.
Funds, administrative costs, interdepartmental.
Yeah. So
And I
for
think
folks
Sarah,
that weren't at that meeting, that's those are the 3 things that Vesla identified that were wonderings for her. Does anybody else have any wonderings that we would like to add to that list? I think Allie Bishop does.
I was just going to say that I think that Sarah and Anne have been really helpful today talking to us about some of these topics.
Yeah.
And I wouldn't want us to bring Champ just to have him have to tell us what Sarah and Anne have said, which is that like legal is complicated. So I guess I would think that we might want, I mean, these aren't bad questions, but I also wonder if we, maybe we should ask him questions that he can answer. Like, you know what I mean? Like and I don't mean that they can't be these topics, but maybe we would want to expand more about like, I'm not exactly sure what those would be, but I just want to acknowledge that, I mean, I know we don't have a bigger depth of knowledge about how we're going to get through these things, but Sarah and Anne have been really helpful today.
For sure.
So I'm not sure if we can be more specific with our questions, and if it doesn't feel like it's worth his time, if we're just going to say, hey, tell us more about this, and he's just going to tell us what Anna and Sarah said.
Well, I don't know that I do think we should keep gift of public funds on there. I don't know that we need to talk about the, administrative costs and spending there. But I do think the gift of public funds discussion is still totally relevant.
In interdepartmental bottlenecks, do you guys feel like that encompasses some of the stuff we've talked about a lot with childcare providers? And I'm not sure, like, I do not work in government, but I'm not sure if this is even something we can ask if someone will just explain why it works this way. We've talked about a big barrier for childcare providers is the reimbursement model, because childcare providers do not have cash to pay for things and wait to be reimbursed for them. So it's been also the formality of RFPs for smaller providers and technical support there. So I'm not sure if that's something that is a CHAMP level question, or if that is not, if that's not a CHAMP level question.
It was reimbursement. What was the other piece, Allie?
So the reimbursement model where centers or people,
got that. Oh, it's the smaller, the smaller RFPs.
Yeah, like we found that it's easy for some of the same people to get money when it's and I mean, I also am not, I don't have a specific RFP to like that I'm sorry, it is the workday that I am referencing. But
that's okay.
The idea that like, so like, like any barriers to some of our smaller childcare providers, and I can't think of any specific RFPs, but I know that has come up. But I don't know if that's a CHAMP level question. Because I think there's also like structures in place that work across health and community services. And as they're applied to something as new as a health and community services department doing early learning stuff, which isn't the most common thing for health and community services to do in our country, that it's kind of trickier for some of our providers to participate with.
I think it's good to bring up, because I'm pretty sure there's some specific recommendations in the SEVA report around making the RFPs more accessible, like not having them have to be delivered in person on a dead tree. And definitely I know that reimbursement model has come up quite a few times. So kind of contract process questions. Is that what we want to call that?
I'm very mindful of what Ali indicated of, having CHAMP here for the sake of having CHAMP, when frankly our real source of information is probably Anne and Sarah, frankly, not to be whatever. But so one of the questions I did have for CHAMP and still have for CHAMP is I would like him, and I don't think that this would be a right away, I'd like him to get his feet underneath him at the county a little bit more, in our community a little bit more. And I would like to know from him what he thinks the task force should be working on. I know that we are in charge of ourselves and we make our own decisions, but it is important for me to know what the head of this department would focus our time on if he were in charge of us, because it's just, I think we need the insight, especially as we start, I believe, moving forward more fluidly with the Healthy Children's Fund. That is my biggest question for him. I think I would like to put on the agenda for next meeting. This just came to me, so apologies, but this conversation, I think, would be helpful. I think if the co-chairs put some specific things on the agenda to pull out of the SEVA report for us to talk about and understand better. and guide the discussion better and more directly with Sarah and Anne, maybe about how can the task force help you. There's only so much they can do. They can't keep beating their head against the wall. But is there something the task force can be doing by making a recommendation and specifically making an ask of council to do X, Y, or Z that would help their jobs? For instance, would it be helpful for us to make a recommendation and get in front of council and say, we want the county to do this and change its policy in this way that will help the Healthy Children's Fund have greater administration? I'm very curious about that, and I don't know what I don't know.
And Sally, you're saying do that at the co-chairs level with Anne and Sarah?
I'm thinking that if the co-chairs could work directly on a specific agenda item that we could bring to the task force to be really efficient with the task force use of time, like maybe pull things out, excerpts out from the SEVA report and make suggestions, and then present something that we could get the task force to buy off on. And I think Sarah and Anne would have to be a part of that in some way. I'm not sure how though.
Does that work for you, Sarah?
I would love
Anne?
that. Would love that.
Okay. Cool. Well, so where did we land on questions for Champ? Do we want to send him some questions or do we not? And I'm curious what Sarah and Anne feel on this one too. Because are there things that would, again, like Sally was saying, are there things that would be helpful for us to weigh in on your behalf?
Mm-hmm. I will just say I think that Champ is still learning, and a lot of information he gets is from Sarah and I about where things are and what's going on in the history of stuff, just because we've been here longer. So I think maybe holding off on questions for him, and like you mentioned, Sally, kind of like how the task force can be helping the cause and the county. I think that's a great idea, just to give him a little bit more time to kind of get his feet under him and then start figuring out how we can be working together to moving the cause forward.
Does that sound good to the rest of the task force? Okay, seeing nods and thumbs up and no heads shaking and thumbs down. So cool. All right. Thank you, everybody.
Okay, thanks, Tilda. Looks like we've hit the last portion of our agenda. So if any task force members had anything else they wanted to comment on, we have still a few minutes left. Otherwise, we can give you a few minutes back in your evening. Okay. All right. Well, thank you, everyone. We will see you next month, and appreciate all of your work. Thanks.